Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
Oh, it is very important to listen to and respect the needs of patients. However, there are big differences how patient voices are integrated into healthcare decisions. For example, while recent regulations require the participation of patient representatives when discussing access or other important decisions, there are still countries without kidney transplant advocacy groups, like, for example, Belgium. Currently, kidney transplant patients must undergo lifelong immunosuppression so that they don't reject their kidney because the immune system perceives it as a foreign object. The immunosuppressant leaves these patients vulnerable to other infections. To combat this, the biotech and pharmaceutical companies are conducting research to identify solutions to reduce the risk of organ rejection, minimize the risk associated with immunosuppressive drugs. These innovative approaches must be evaluated in clinical trials, which can take years before they come to the general public. When I started my medical career 20 years ago, individuals who underwent kidney transplant faced several challenges: limited duration of the grafted kidney, access to few medications to prevent the transplant rejection, and limited tools for meticulously monitoring the graft health. Historically, pharmaceutical companies doing research and development didn't typically consider any input or interaction with patients. I personally found that the two groups were just coexisting, but not cooperating for better solutions. Patients offer valuable perspectives that should be considered in clinical trial design and development, given their first-hand experience with the diseases we are trying to treat. Luckily, the field has advanced to help address these challenges, and industry has been working hard to incorporate more patient perspectives, which is a welcome change. Yes, Sangamo is currently testing a new CAR Treg cell therapy, which has the potential to change the way we treat patients who need solid organ transplant by reducing or even eliminating the need for lifelong immunosuppressants. We currently study this in kidney transplant patients, and in March we dosed the first ever patient to receive the CAR Treg cell therapy in a clinical trial, so-called Steadfast trial, an investigative cell therapy for the prevention of immune-mediated rejection of HLA-II mismatched kidney transplant. This first patient is doing very well without any adverse events after 4 months after the infusion, and we have been planning to dose additional patients later this year. For background, CAR Tregs are a type of cell therapy based on living cells called regulatory T cells or Tregs that help regulate the immune system. We are able to target the CAR Treg cells to the transplant patient's kidney, which we believe will leave the patient's immune system intact to fight all the infections. This has the potential to be a game changer for patients, and we are excited to continue to refine our understanding of CAR Tregs to advance in that field. In my experience, social media opens many opportunities for patients to connect with advocacy groups which offer a wealth of information about the transplant experience. These groups can help patients understand and connect with clinical trials, and in my opinion, clinical trials are an underused opportunity to get access to treatment innovations.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.